So we've covered the first and second stage of labour, and now we're at that beautiful, joyful moment where baby is received up into your arms, and we're at that point that we would really recommend skin to skin. Skin to skin has benefited both babies and mums, and also in relation to COVID, we facilitate dads to do skin to skin because there's nothing like family bonding at this really special time. So it's a very reverent time just after that birth. I would just ask everyone to stop, take that moment, acknowledge the magnificence that has just happened, congratulate your partner on all that she's done, and vice versa. You know, thank your partner for supporting you in the most magnificent thing you've done together. So these babies, as they transition, they come up into your arms, and during that time we're observing their movements, their respirations, their tones, but really what they need is the care of their mum. We keep their face and nose to the side, and we ask mums to relax back and do nothing. So this regulates mom's heart rate. It also regulates babies. It encourages any fluid to come out from the nose and the mouth. And during this time, we delay cord clamping as the flow of blood from the placenta back towards baby is really, really beneficial. And this is one of the things that we have noted over the last few years, the benefits to babies in relation to not clamping too soon. In the event that baby doesn't transition and finds it difficulty to take that first respiration, we do clamp the cord and we take baby immediately to our resuscitator. It's usually where we dry, stimulate baby, and sometimes just give a little suction and oxygen. Again, we're really well trained in relation to the first breath in the first minute, and we support babies and moms at this time. But in a healthy, well baby, where they belong is right next to you and your partner. And this is a time where it's just like a magical bubble. Things slow down, time really eases. I would ask those that have this moment not really to be too worried about ringing anyone, just be in that moment. So during this time where skin to skin is occurring and the delayed cord clamping is facilitated, the midwife at that point is observing for any signs of separation for the placenta in the third stage, and you'll be supported in the delivery and the birth of that placenta, and we observe then, as Linda mentioned earlier, for any signs of bleeding. In this moment also, we just allow a golden hour of really no separation from mums and babies unless it's medically indicated in relation to your baby. So that 1 hour is so important. It is where baby is most alert. They are really intuitive. They're really looking and searching out, and they're wanting you to communicate. And this is where this love it flows between mums and babies and dads and their family. So this is just a really special time. After that hour, we then weigh baby, and this is usually where people like to make the announcement, and this is the social announcement where everyone has been waiting. And I suppose, especially in times with COVID, our families have been such a support, but doing that from afar, and we really appreciate everybody who's understanding that we can't have families coming in and out of the hospital, and I suppose our thanks to those families for understanding in the last couple of months when things have changed so much. So during this golden hour, we're looking for signs that baby is looking for a feed, and if you hope to breastfeed, we will support you and baby to feed within that hour. And if you choose to formula feed your baby, we'll support you and teach you how to do that, all in the labour ward. And I suppose for dads, it's a lovely thing to do to be able to give that first feed, and for mums that are breastfeeding, it's a really, really lovely time to get that feeding established. Whichever way you choose to feed your baby, we are there to support you, and we will help you in every way. So once we've done a full head-to-toe check with baby, we offer vitamin K, and vitamin K is a vitamin that we have been giving babies to improve their clotting factors. I would ask you all to read up and look at this. We will be asking you for consent in relation to this. It can be given by an injection or an oral form, but it would always be given in the labour ward, as we would like to have this well established early on.